the workhorse for evaluating reproductive potential in men and their fertility is something called a semen analysis. It's exactly what you think it is. So it's a test where the man comes into a fertility-specific laboratory, which I recommend not going to a general commercial lab or a hospital lab. Definitely go to a fertility-specific lab that does a lot of these tests and can interpret them for you. They're going to look at 3 to 4 main parameters. They're going to look at the count in millions, called concentration. They're going to look at motility, which is the percentage of sperm that are swimming, trying to get to the egg. They're going to look at the forward progression, which is not how many of them are swimming, but how fast are they going. That's a qualitative measure. And then they're also going to look at something called morphology. Morphology is a fancy word for the shape of the sperm. Now, what I always say to every single one of my patients is that please don't worry, a funny-looking sperm does not equal a funny-looking kid. It does not work like that. It just means that abnormally shaped sperm can sometimes be less efficient at fertilizing the egg, but the DNA that it is delivering should be pristine and without any problems. Now, a semen analysis is, like I said, is the cornerstone of male fertility, and I definitely recommend at least one and sometimes two, because it's obviously sort of a funny test where a man could feel a little anxiety or a little frustration or even a little embarrassment coming into a center. Now, fertility centers have separate wings of their practice, have separate rooms, private rooms, even separate entrances and exits for the guys. So I really want to tell your readers that it's not an embarrassing thing and no one's really knowing what you're doing or caring what you're doing. It's very important to hear that. But some guys do get a little anxious or worked up, and the first semen analysis may be a little off just for that. There are bad days. There are good and bad days for everything, including a semen analysis. So more often we'll bring them back for a second semen analysis to compare the two. Now, in general, the normal count for a male, the normal concentration for a male is above 15 million sperm per cc or milliliter. That is the 5th percentile of the population. That is what they consider the floor for fertility in natural populations. For motility, we like 40% of them and above to be swimming properly. We like forward progression to be about 2.5 out of 4, so 2.5, 3, 3.5, 4. And we like morphology in the strict Krugers, Krugers, morphology system to be 5% or above. Now, those low parameters are considered the 5th percentile. I always caution patients who say, oh, I'm 16 million, I'm normal. No, you're low normal, you're at the 5th percentile. It doesn't mean you cannot get pregnant, but it doesn't mean it's necessarily a great number. So that's why this conversation should happen with a board-certified reproductive endocrinologist and infertility specialist who can put this conversation in context. Now, there are some additional, more modern testing that we can add on to this. There is something called sperm DNA fragmentation assays, ASSAYs. There's many different names for these studies. Some are called COMET, some are called TUNNEL, but by and large, they are very high-tech ways at looking at the actual DNA that sperm are delivering to the egg. Think of the DNA that a sperm has to deliver into the egg as an extremely long thread or wire that has to be spooled and coiled over myriad different spools, and it has to be very nicely wound and tightly compacted and in a nice fashion, rather than something that's just haphazardly strewn about and can knot up and be fragmented and can be nicked and might not be as tightly wound and protected as it's trying to get that DNA into the egg's nucleus. Now, DNA sperm fragmentation index testing is controversial is the wrong word, but I think that it is a test that we don't know exactly what to do with the information. What I mean by that is that there are some men whose sperm DNA fragmentation is very, very high, but they have no trouble getting their wives pregnant, their partners pregnant. And there are some men whose DNA sperm fragmentation is very, very low in a good way, and they're having trouble. So there is no level above which you are guaranteed not to have a baby, and there's no level below which you are guaranteed to have a baby. And so it is almost a test that we don't know what to do with the answers, or a test or a technique that we don't necessarily have an indication for. The way I would use this test is if I have couples who have really unexplained fertility problems that go beyond their metrics. In other words, a semen analysis could be great, but they're having trouble growing embryos in an IVF lab past a certain time, which would indicate sperm problems, or they're having fertility problems, or even a condition called recurrent pregnancy loss, which is multiple miscarriages. There are many sources who believe that DNA sperm fragmentation may play a part in that. The problem again with this test, however, is that we don't exactly know how to fix it or what to do with that information. And so the tried and true things are to get the man in shape and clean up healthy living habits, which I'll talk about in a second, get them on high doses of antioxidant vitamins and the like, and also do something called ICSI, or intracytoplasmic sperm injection, which is an IVF technique where we inject sperm directly into each egg. However, in many cases, we're doing that anyway. And so we're now performing a test for which we don't have any really good tools to fix what the information tells us. So I'm not saying it's a bad test, and in the hands of the right people and the right counseling, I think it can only add to the clinical picture. However, it's not 100% accepted by the greater reproductive community as a general test that should be done on everybody.